Okay, good afternoon. My name is Rusty Leeds. I'm Assistant County Manager. This afternoon we are here at this press conference to announce the appointment of Steve Stonehouse as the Permanent Director for the Department of Corrections for Sedgwick County. Steve has been an employee of the county for approximately 24 years. All of that time has been with the Department of Corrections. Over the course of his career, he worked from the floor up, starting as a ISO 2, an ISO 3, and then an administrator over juvenile field service programs. And then he was promoted to Deputy Director in 2013. For a period of time, about 4 years, he was the Deputy Director of both Adult and Juvenile Services, and then through a reorganization in 2017, he became the Deputy Director of Juvenile Services. We added another Deputy Director to take over Adult Services. Steve has a bachelor's degree in social work and a master's degree in public administration. He also earned an executive certificate from Georgetown University, where they did some work on juvenile issues, and a management certificate from Wichita State. Steve has experience over those 24 years working with residential programs, residential facilities, detention facilities, with evidence-based programming and the implementation of those programs, the management of. What I'll tell you is that I know that Steve, like all the members in our corrections department, he cares about people, he cares about kids, he cares about adult offenders, and trying to make sure that they get the services that a community corrections department is able to provide to help them successfully transition out of their rough period back into normal life and minimize recidivism in our community. That's the key, one of the key elements of public safety in our community, and part of the justice system that's really important. So with that, I won't drag on, but again, we want to congratulate Steve on his promotion. And at this time, I'll bring Steve up. He has a few words, and then he'll be available for some questions. So with that, Steve, congratulations.
Thank you.
I will move my stuff.
Good afternoon. Thanks for coming. I want to start off with saying I'm very excited about this opportunity, and I look forward to what the Department of Corrections can do coming out of the pandemic and our staffing crisis that we're currently in. I've worked for the Department of Corrections in Sedgwick County since 1998, and I've been very fortunate to have wonderful mentors, leaders, and supervisors. I'd like to thank Mr. Leeds and Mr. Stoltz for this opportunity, and I'd also give a special thanks to Lori Gibbs and Chris Morales for our time as deputy directors together. We worked through some tough staffing situations, and I know that the best is to come because of what we've done in the past. The Department of Corrections, as does all of our community, faces unique challenges in our staffing situation. I'm optimistic about the future because of what the Board of County Commissioners did in raising our pay for critical staff members. This is vital for us to have a strong workforce to be able to recruit and retain employees, which directly affects our ability to provide quality services to the citizens of Sedgwick County, our clients, and their families. Sedgwick County Department of Corrections exists to provide community supervision, local services, and alternatives to jails, prisons, and correctional facilities. Without a strong workforce, we simply can't complete our mission. So I'm very excited and optimistic that the BOCC has responded to increase wages to help with this critical service. My immediate plans for the Department of Corrections is to implement the Community Task Force's recommendations in the wake of Cedric Lofton's death. This is something that we started working on before the task force was formed, and we look forward to reporting out to the task force in August exactly what we've accomplished and how we're going to meet the timeframes that they've given us. Continued attention to staffing at all programs and to increase the capacity at the adult residential facility, work release facility, and the eventual reopening of the juvenile residential facility. We know that these are important alternatives, and they're best practice to have these available for the offenders that we care for. And finally, I want to establish and maintain open channels of communication with all levels of SCDOC staff members and engage them in moving the department forward. I intend to seek innovations from all levels of DOC staff and to work diligently to implement them to ultimately improve services to our clients. A longer range goal is for the department includes updating our strategic plan. I look forward to hearing from community stakeholders, clients, families, service providers about how the Department of Corrections can enhance community safety through effective community-based programming. That's all I have to say. I'll take any questions anybody has.
Sorry, there we go. I know you mentioned the juvenile residential facility. Do you have a certain timeline of when we might see enough staff to start reopening that facility?
We've set more of a staffing level goal instead of a time frame. So we know that we have to have a certain level of staffing in order to do 3 shifts and safely. So we've established that benchmark and we're working towards it every single day. The staff members who are still assigned to that program are simply working in other programs right now, either at the adult residential facility or in juvenile detention. So they remain in their slots so they don't get lost in the shuffle, so we know exactly what levels we have to hit.
And then with the staffing crisis we've been under, I know you mentioned this wage increase will make a big difference. Is there any other goals or ways to tackle and get more staff in?
Well, I know on the department level and on the county level, we've been working on recruitment. So we have a full-time recruiter, and we'll continue to work on getting our message out about what a great place Sedgwick County is to work, and specifically at the Department of Corrections. So right now, those are the 2-prong approaches that we're taking. It's to stabilize it and stop folks from finding other positions, and then to increase their levels. It has worked. Staff are excited about their jobs again. Staff do feel better about coming to work, and we have had at least one person rescind a resignation on the day the new pay increase was announced, just because we're competitive again.
Are you looking at changing any skill sets that you're looking for potential applicants in that, that whole process? What types of skill sets and requirements are you looking for people who might want to work, especially at the juvenile detention facility?
I think that folks that want to work at the juvenile detention facility, typically if you like kids, that's the place for you. If you like teenagers, that's the place for you, because that's how we see them. They're kids first, and then in a detention center second. I've spent some time at the adult residential facility, and the skill set to work there is just communication and want to help people. I mean, this is really, if you want to get involved with some folks, and if you believe that somebody isn't defined by the worst day of their life, and they can change and move forward, this is the place for you.
Just was curious about the KDOC audit that they did. Why weren't those things implemented?
Well, I think right now that's part of the lawsuit, so I can't speak to that. But I will tell you that we're implementing everything that has to do with the task force. And I look forward to the results of what they have to say, what we report out to them.
Could you talk more specifically about what you guys have implemented that they recommended?
Sure. So the majority of the policy recommendations have already been written. They're in various levels of approval. The Board of County Commissioners have also approved a contract with a new medical provider to have 24-hour nursing care, and to also expand mental health services at JIAC to have mental health staff available there. So that's was recommended by the task force and then was approved by the BOCC for a new contract. Those contractors will be on site beginning August 25th. Our previous provider gave us notice. So in this, between August 25th and the first of the year, they're going to be really ramping up their programs to try to meet our needs for that. And then we've also, like I said, continuing to work on policies and helping staff understand, and the training on the policies and training on the restraint system to ensure that folks understand the changes that have been made to the restraint system, specifically when somebody is in the prone position, that is not a long-term restraint, that is temporary, like we've talked about before.
Right, and then previously Sheriff Jeff Easter has called, you know, the jail, you know, the largest mental health facility in our state. Is there a hope that some of the substance abuse and mental health coalition recommendations and stuff can kind of help start to combat that issue we're seeing?
Absolutely. The Sedgwick County Department of Corrections Adult and Juvenile Services have seen more deaths from drug overdoses than we ever have before. So this is new for us. This is hitting us in a way that is completely unexpected. Fentanyl use in our community is something that we have to adapt to. I know in adult services and in juvenile services, we have folks in need of mental health treatment. We have kids in JDF who have been approved for a state hospital and there's not one for them to go to. The court has ordered somebody for an assessment at a state hospital and they can't go because there isn't one. So we know this is a problem and we're hopeful that the coalition's recommendations are implemented so we can move forward on some of these issues.
And then what other changes have been made since the Sedgwick Task Force has made their recommendations, and what are you looking to implement now or in the coming months?
So like I talked about, the 24-hour nursing, the change in our training of a restraint system and updating on our policy and procedure. And also there's an MOU in the works with Wichita Police Department. We've been working on that for quite a while, but we've found common ground with them on how we can move forward and have a good understanding of our role and their role in juvenile justice when kids come to JIAC. So those have been significant changes that we've seen. As well as, I mean, there's a capital improvement plan for updating our security system at JDF to include audio. I've spoken before about the challenges with that. We have examples from detention centers and jails around the state where there is audio, period. It's not necessarily clear because these are hard environments. So it's going to be a challenge for us to work with our vendors and find solutions that work and actually make sense.
The memorandum of understanding, what, you guys didn't have one in place before with the police department?
We did not.
What's different than in it this time?
Well, I think it was a recommendation coming out of the task force as well, because we have had one with the sheriff for a number of years. And the Kansas Department of Corrections, who oversees JIAC, has in their standards of operations a recommendation for an MOU with the law enforcement entities. So there's been fits and misses over the years with WPD, but the momentum coming out of the task force really helped us put some momentum together and get that taken care of. It's not signed yet, but it's in close. It's close.
We'll take 2 more questions.
And then with, or do you foresee any issues with so many new parolees coming into Sedgwick County, and what do you plan to do about that?
Well, parolees are assigned to the Department of Corrections, so we don't have a direct role in that. But I know that at the Adult Residential Center, their capacity is down due to our staffing situation. So more individuals assigned to adult res and work release are not able to get out of the jail to come to take advantage of that program. Because the adult residential facility, the clients all work, they have a job, and they pay rent for their services there. So it's an important program where we're not able to fully take as many people as we would like to because of our staffing levels right now.
I guess I'm just curious, like, why you'd want this position, seeing all the things, the shortages, kind of the issues with JIAC, and then what, like, the future looks like. I mean, he's talked on some bright spots, but.
Well, the future is going to be a lot of work. I mean, it's not an impossible position, but I know that the staff that we have are the best in the state. I know that we have the ability to be leaders again. We've never really stopped being leaders, but we've just had so many challenges with the pandemic, with staffing, with pay, with turnover. I think we're starting to come out of that, and people are starting to get energized again. And as we get more staffing and start programming again and start something new and re-energize people, I think that's what makes the future promising.
And, like, why would you want to step into that role? All this stuff.
Because I think honestly that a challenge is good for everybody. And I know the staff that we have and I know what they can accomplish, and I look forward to doing that with them. I look forward to helping them make the changes that we need to serve kids, families, and adult clients, and ultimately the community better. I believe in what we do.
Thank you so much, everyone. Appreciate you coming, and that's the end of our conference.